I want you to imagine a labor and delivery room. It's 3 a.m. in the morning. Mom is exhausted and she's been contracting for 14 hours. Her epidural is working pretty well for the pain, although her anxiety is through the roof. Her blood pressure is creeping up, and the baby's heart rate has these little late decelerations that are making me, as the nurse, watch her baby, and the monitor like a hawk. She looks at me and whispers something I have heard probably thousands of times. I can't do this. I am so scared. As her nurse, I have followed the protocols. I've given her her IV fluids. I've repositioned her. But in my gut, I know she needs her nervous system to calm down right now for that baby. Now, what if I told you a major hospital ran a study on pregnant women and found a non invasive, zero risk therapy that dropped anxiety by 94% and improved breastfeeding success? Hi, if you don't know me, my name is Kimberly Ray. You can call me K Ray for short. I am a former labor and delivery nurse. I loved labor and delivery. And when I came across this study that we're breaking down today, the Hartford Hospital Reiki pregnancy study, I just sat right down and said, I'm going to film this video for you all. I want to let you know that Hartford Hospital is one of the oldest and most respected integrative medicine programs in the country. Back in 1998, they launched a Reiki volunteer pilot program specifically in their women's health department. And when I think back over my career as a labor and delivery nurse, I can think of so many times where it would have been wonderful to have a Reiki practitioner in the room or someone transmitting Reiki via distance because of just the power that Reiki has to calm your nervous system down, especially now where there is so much emphasis from the medical community to just give medications. And in pregnancy, that is not always an option. For those of you who don't know, Reiki is a Japanese healing techniques where practitioners transmit the Reiki through their hands, either in person with light touch or hovering like above the body, or it can be transmitted via distance called a virtual Reiki session. Reiki means universal life force energy. For any medical skeptics in the room, this study was a hospital pilot program followed by a randomized control trial with zero adverse events reported. Zero. So when we talk about safety in pregnancy, that is the gold standard. Let's get into the data because this is just what made my nurse brain go, wahoo! I think everyone should have Reiki. Hartford Hospital tracked outcomes for pregnant patients receiving Reiki. Here's what they found in that initial women's health pilot. 94% reduction in anxiety. Read that again, 94%. If I had a medication that could drop a mom's subjective anxiety by 94% without crossing the placenta, I would be ringing up the doctor and saying, give me the order so that my patient could have a less stressful labor or antepartum experience. Here's the second one, 80% reduction in nausea. So for those moms with hyperemesis, which can often occur in the beginning of pregnancy, sometimes it goes all the way through. Sorry, that's too much info. or just that brutal third trimester acid reflux nausea combo because there's just no more room anymore to take in a whole lot of food. And every time you eat, you kind of feel gross. Oh, beautiful to have some Reiki to help relieve some of that discomfort. There was a 78% reduction in pain. Now, we're not talking about completely eliminating pain, but reducing the perception of pain. And so this can be helpful if you have a really longer first stage of labor, or if you're someone who doesn't want to take a lot of medication, or if you want a lighter epidural. And if you want to know about that, please talk to your anesthesia team before labor so that you'll know what's available at the hospital or birthing center that you're giving birth in. All right, 86% improvement in sleep quality. But wait, it gets even better for my postpartum mamas. They followed up with a separate randomized control trial focused on the third trimester. And you know what they measured? Breastfeeding self-efficacy, meaning how confident you feel about breastfeeding your baby. So I can't tell you how many times I've been in the room in the middle of the night. The baby's crying and the mama is crying. She and the baby haven't figured out the breastfeeding dance yet. When a woman has self-efficacy or confidence, you know what I noticed was the women who came from cultures where breastfeeding was encouraged and was the norm, these women seem to have a higher self-efficacy or confidence than women who didn't come from that kind of culture. And so if Reiki can help any woman have increased confidence in her breastfeeding skill, or her ability to learn how to do the dance between mom and baby, well, that is priceless, because the benefits of breastfeeding are immense. The randomized controlled trial found that moms who received Reiki in their third trimester had statistically significant increase in breastfeeding confidence over the first 4 weeks postpartum compared to the control group. Now, let me translate that from research ease into language that anybody can understand. Moms felt calmer. They trusted their bodies more, and they didn't give up on latching during the hard cluster feeding nights that can occur when the baby's going through growth spurts, especially in the first couple weeks, 6 weeks of life. Let's talk about the physiology, why this works, why Reiki is such a wonderful tool for the pregnant woman. So it is neurophysiology. When a pregnant woman is anxious, her sympathetic nervous system is on fire. Cortisol and adrenaline spike, and that stress response diverts blood flow away from the uterus and away from the placenta, and it can lead to maybe longer labors, more interventions, and possibly fetal distress. Now, when a woman chooses to use Reiki or some other complementary therapy that is known to trigger the parasympathetic nervous system, the rest and digest state, this is when the heart rate drops, blood pressure stabilizes, and oxytocin, the hormone that is significant in labor and bonding, can actually do its job better when cortisol is low. Think about it. We are animals at heart and and body. And when we are highly stressed and in labor because I have seen this happen. I have seen women come in from home to the hospital and then their labor stalls because maybe a little bit nervous in the hospital scene. They're like, oh my goodness, this is really real now. We got to do this now. And their bodies can kind of shut it down for a while until the woman acclimates to the hospital setting or the birthing center setting. And then their labors pick back up again once they feel that they are safe again. I have seen this so many times. Okay, so how do we use this in real life? Here is what you can do to increase your calmness and decrease your stress levels. So you can ask the hospital or birthing center where you are choosing to deliver if they have Reiki practitioners available to the patients, or if you're going to have a home birth, you could hire a Reiki practitioner to be a part of your labor and delivery process. And along those lines, you can also hire a certified medical Reiki practitioner like myself to give you Reiki throughout the process of becoming pregnant, being pregnant, and then through the delivery and the postpartum period. Now, if you can do without any Reiki is that you can practice calm. So every morning or evening, you can sit and take some deep, slow breaths. Send out the intention to the universe that your labor is going to be smooth, that the will be healthy, and that you're going to be healthy, and that you're capable and you can handle the labor process. This is something that I do with clients who are pregnant and birth is upcoming. We often do a lot of mindset work around the fears instilled in us around the labor and delivery process. I think about people in the past that I've taken care of, single moms who are laboring alone, or someone coming in for an induction because there is some concern about the baby. And I wish I would have known about Reiki back then, because it can be such a calming presence, and it can change the whole vibration of the delivery room when you have someone there or virtually who is sending Reiki and knows the labor process and believes in a woman's inherent ability to give birth, and is also cognizant of the fact that it is normal to feel fearful of the unknown, which labor is. Every labor is different, every birth is different. So I feel that Reiki is such an underutilized resource in this category of healthcare. For my fellow nurses and birth workers who may be listening to this, Reiki is a tool that we need to advocate for. It costs nothing in supplies and it has zero side effects. And it gives the patient a sense of agency in a time when they often feel out of control. It means a lot to a laboring woman to know that her wishes are respected, and for her to have a Reiki practitioner there in the room with her, or over Zoom, over a FaceTime call, can be so empowering because she knows that she has taken the steps to help calm her body and her mind with the power of Reiki. So let's recap what the Hartford Hospital actually proved to us. Reiki in pregnancy slashed anxiety by 94%. It drastically improved nausea, pain, and sleep. It gave women confidence to breastfeed successfully. And it is 100% safe with zero adverse events reported. Here's the truth I want every woman to hear. This preparation doesn't start at like 12 weeks, and it definitely doesn't start in active labor. That shift into pregnancy, that first trimester, can be one of the most tenuous times of your entire motherhood journey. You are navigating possibly morning sickness that wipes you out all day. I had that. You may have an invisible or visible fear of pregnancy loss. There may be that bone deep fatigue that comes from hormones fluctuating like a roller coaster where you can barely keep your eyes open, let alone process the fact that your entire life is about to change. During that first trimester and your whole pregnancy, your body is building a human from scratch, and it is exhausting physically, emotionally, and mentally. That is exactly why I don't wait until we're maybe in the second trimester to step in. I offer pregnancy preparation and early first trimester support to help your mind and body anchor into this massive transition with grace before overwhelm has a chance to take root. We soothe your nervous system early so that when the fatigue hits or any fears creep in, your body has a memory of calm to fall back on. This is so important to build that resilient calm. And, we don't just stop there, because I know what happens when we wait until 39 weeks to start managing anxiety. And I know what happens when we only offer support during active labor. It's reactive. And frankly, it's too late to build that skill of calm. This is why I now offer virtual Reiki sessions and some in home or in medical facility Reiki sessions in the Nashville area. I tailor the Reiki sessions to each trimester, to each woman's particular symptom or anxiety management profile, that you can transition through those first tender weeks all the way through postpartum with a feeling of empowerment and a feeling of calm, that you know that you are capable of birthing your beautiful baby. I start with you whenever you need me, whether it is before your first fertility doctor's appointment, or you call me that day when you get the positive pregnancy test, or maybe it's in the second trimester when you start to feel your baby move. Or maybe it's in the third trimester when your belly is bigger and your back might be hurting and your sleep might be becoming a little bit more compromised. I personally believe the earlier we start, the better. We calm your nervous system early so your body remembers how to relax when the big day comes. We build your physiological resilience now so that when labor hits, or if you're someone who has had C-sections and your C-section is scheduled, I want you to know Reiki has shown to improve surgical outcomes as well. So it is not just for the women who are wanting to have a vaginal birth. It is also for women who have had C-sections or are planning a future C-section. We build your physiological resilience early so that your nervous system knows exactly what to do, no matter how you deliver your baby. What we want to do is allay any fears in the mom that she has done everything that she can in her power to have a safe and beautiful birth of her choice, that her needs have been respected, and that it has been a holistic experience, mind, body, and spirit. No matter how you choose to birth, whether it is a natural delivery or a medicated delivery or a C-section, a surgical delivery, we want our moms to feel empowered, because when women feel empowered in birth, that translates into feeling more confident in their mothering skills as well. We calm your nervous system early so your body remembers how to relax when the big day comes. We build your physiological resilience now so that when labor hits or your C-section is scheduled, your parasympathetic nervous system knows exactly what to do. The research is clear, the safety is proven. My nurse brain demands that we use this tool proactively from the very beginning, not as a last resort. The research proves it reduces anxiety by 94%. The hospital proved it's safe for you and your baby from the very first moment of conception onward. Now, let's see if we can completely change any fear-based birth stories in your head into one where you are a fiercely confident woman ready to give birth to your beautiful child. Again, my name is Kimberly Ray. Thank you so much for watching all the way to the end. Please like, subscribe, share, save this video, and I will see you inside of the sessions. Take care of your baby and take care of you. I will see you in the next video soon.